misinformation and fear that was very interesting. Yeah.
Okay. Well, let's start. We're live now, so hey everybody who's going to be watching. But just say hey, this is Dr. Tracy Gapin, and you're listening to the Break It Down Show.
Hey everyone, this is Dr. Tracy Gapin, and you're listening to the Break It Down Show with Pete Turner.
Yeah, Tracy's been on several times before. If you guys don't know, you can go to the breakitdownshow.com website and look up his name. We've had him on, gosh, with Chris Major and with Attila Haidu, and you have a show coming up with Dr. Larissa, all talking about optimization and particularly health, but specifically men's health and precision medicine. So give us just a real quick primer on what that means, and then we'll dive into your COVID story.
Yeah, sure. So precision medicine is really a catchphrase for using your genetics and using epigenetics to take a very precise approach to optimizing your health. Meaning everyone's different, obviously. You know, our genetics dictate how we're going to respond to our environment. And we need to look at all the systems around us to understand how we're going to respond. And so precision medicine means, by definition, that we don't take a blanket one-size-fits-all approach to health. You know, certainly there are some general guidelines that we could recommend on boosting immune function right now and on optimizing your health and your mental status and so on. But precision medicine is where we can really dive deep into the individual and take a unique approach with everyone.
And then let's really quick, just because I know we're going to get into this, let's talk about what peptides are and their role in precision medicine.
Yeah, sure. Peptides are an amazing tool that not a lot of people are familiar with. So peptides are simply amino acid chains. They are multiple amino acids, anywhere from 2 to 100 amino acids linked together. And they serve as signaling molecules, signaling agents in the body that your body already recognizes. Your body is already familiar with these signals. And so you can use peptides to signal the body to create a wide range of outcomes. So we can use peptides to boost immune function, which is particularly relevant right now. We can use peptides to boost our metabolism. We can help inflammation. We can help with recovery, with joint inflammation, joint recovery. We can help with neurodegeneration and traumatic brain injury. And we can help with cognitive focus. Peptides are amazing for weight loss and for building muscle. They're actually great peptides for hair loss and for skin rejuvenation as well. So there are a wide range of functions of peptides, but basically they're biologic. They are recognized by the body because they're simply amino acid chains. You know, the very first peptides we ever had back in the 1940s, the first one was insulin. Insulin is a peptide.
Wow.
Growth hormone's a peptide. We now have many other peptides that are currently available that we can use for specific functions.
So you're an actual doctor, not like a historian, not the other kind of thing, a medical doctor, which is such a rare thing in the health field. This sounds crazy to say this, but it's so uncommon to have someone who's got the letters MD in front of their name. So when you talk about this, you're talking about this who's not only someone who's been through a residency and years of medical practice, but continued development to understand precision medicine, epigenetics at the level that you know, look, I might read 15 books. That's a tenth of what you've done book-wise, and I've got huge blank space for that. So why would anybody take health advice from me? You're the actual doctor.
I appreciate you saying that. It's funny, times right now, it's amazing how everyone is suddenly a coronavirus expert, and everyone's, you know, venturing their opinion. And I know everyone has good intentions. They're all trying to help and promote some, you know, important, valuable information that they think is important. And you know, everyone's trying to do the right thing. There's just unfortunately a lot of disinformation out there. There's a lot of false information out there, and there's a lot of bias, and it's a very confusing time right now.
Yeah, no, that's fair. It's a very confusing time. Actually, because of the show, I know someone who studies infectious diseases at UCI, Irvine, which is, you know, one of the top places in the nation for this. And this doctor, you know, not to undermine the threat and everything, but this is what this person does for a living. And he said, hey, this is going to be like a nasty flu. And, you know, if we really care about, any of these outcomes, you should pay attention to how often the flu kills tens of thousands of people. And then he specifically said, really want to help save a life. Suicide's going to kill way more people was his thought. This is well over a month ago going in. But he basically said, these things happen. He didn't think it would be a big thing, with the caveat of, hey, we never know. But sure enough, we're pretty well into this thing, and it seems like the lower end of the number range is what's going to happen. Whew. And yet here we are. I'm talking to someone who, everybody's like, do you know someone that's had COVID? I now know someone because you've had it.
Yeah. Yeah. And I am very fortunate that I had a mild clinical symptomatology and course of the disease. My heart goes out to all the people, all the families who have lost loved ones during this time. It's tragic. I have colleagues who are dying, doctors, nurses, EMTs, respiratory techs, all the healthcare providers on the front lines who are risking their lives. And it's scary for them. You can minimize it by looking at the mortality rate associated with the incidence of coronavirus in general. However, you look at the emergency room in many large cities right now that are overwhelmed, and people are dying, and it's fortunate that the numbers are going to be much less than they initially predicted, and right. I'm hoping and praying that we have actually reached the peak, and the decline in the mortality. So we'll see what happens over the next couple of weeks.
Yeah, and anytime tens of thousands of people die from a new cause that didn't exist before, it's a significant health crisis, and I think that we're handling it in the best way that we can. Let's talk a little bit about your journey into this. I mean, do you have an idea of how you might have contracted it?
I'm not sure. Pete, I'm honestly really not sure where I got it. It could have been from anywhere. Patients I'm around traveling, I really could not say for sure. That's what's unique about this disease, in the fact that there's a large portion of the population who are carriers of the disease with no symptoms at all. And so, I could speculate, but who knows? Yeah.
You're a doctor, so you start to notice things in your system right away. How do you think you caught it early? With, obviously in your article, everybody should read the article. It's on LinkedIn. Go to Dr. Tracy Gapin's account, and if you can't find it, look on my account on LinkedIn, and you'll see the link to it. But you had a fever, but did you have an idea before that you might be sick?
Yeah, so I had night sweats 2 nights in a row. When Thursday morning, Friday morning of that week, 3 weeks ago or so, I woke up with a wet pillow, and I had some night sweats, and didn't think much of it. I thought it was unusual, but didn't really know what to make of it. But then that Friday night is when everything kind of went south, and developed flu-like symptoms with shaking chills and body aches, and my skin just hurt to touch, and my temperature was 100, never went above 100, and that was the worst of it. It lasted about 24 hours, and I was very fortunate they didn't progress.
What do you attribute that to? I mean, some people obviously go all the way to death, but you're in the lower end of the age band, right? If you're not above 65, you're healthy. Is that what you attribute it to?
Yeah, a number of things, Pete. Great question. And I've been asked this question probably 100 times in the last couple of weeks now. I think there's a lot of factors involved. Number one, I preach health optimization to the men that I work with. I preach taking care of your body with a systems-based approach, which means focusing on not what you eat, not just what you eat, but when you eat, focusing on good quality sleep and tracking it, focusing on your stress and becoming stress resilient and mitigating your response to stress, focusing on detox pathways, optimizing hormones, and mindset. And all aspects of this health optimization picture, this systems-based approach where we look at all the systems of your body coming together, I practice that myself every day. And so all that is in preparation for times like these. Everything I do to reduce inflammation and optimize my immune system and balance my hormones and get my micronutrients on track. All that, I believe, helped me to come from a better position, a better angle of health, if you will, when this happened. Now, I also use peptides. So I knew that this was coming already. At this point, things were starting to spread throughout the country earlier in March. And so I had already purchased some peptides for myself, and I was prepared for this to happen. And so that Friday night when this happened, I had peptides that I started on. And I truly believe that my approach to health leading up to this certainly helped, but I believe that those peptides probably saved my life. And being able to get them quickly from the beginning there, by boosting my immune system, boosting my immune response, I believe that's a big reason why my acute symptoms resolved so quickly. So,
wow, saved your life. Yeah, man. Okay, so let's get smart on peptides again for a second here, because it's easy to say all of that, but you're a doctor. Do you just have peptides on hand at the house? Is this something that I could just here's my cold and flu peptide set? How does that work?
Yeah, so peptides are produced or manufactured by a compounding pharmacy. There are very few compounding pharmacies that I trust and that I would rely on to use. And so I specifically use one particular compounding pharmacy that is known throughout the country to be that key reliable source based on quality control, based on purity, and knowing that you're getting a good quality product. And so I use this compounding pharmacy for my clients, and I also purchase some of them for myself as well. You do need a prescription for these peptides. There are certainly black market opportunities out there to get these peptides for low prices, but I would really caution against that as any of these other sites that you can purchase directly as a consumer. You need to worry about quality control. You need to worry about purity. You need to worry about sourcing of the ingredients and oversight. And, these are considered research grade materials unless they're coming from a reliable compounding pharmacy.
So this isn't something that I can just go down to the store and buy a bottle of. I actually have to have a doctor around first.
Correct. That's right.
And what is this? What does a bottle of peptides cost? I mean, I guess in this case, this cold and flu version of the.
Yeah, they vary. There are multiple peptides that have different function. A couple of them, for example, thymosin alpha is an amazing one that upregulates your immune function through T cells and reg T cells. Though that is a great one for boosting prior to getting sick. So if you're asking me what can you do to boost your immunity, before you get infected, that would be a great one that I have suggested to my clients. LL37 is another great one for if you were to get infected. Pentosan is another good one. DHHB, C-Link nasal spray. These are all good peptides for immune function. Cost really varies depending on which one of those you're getting. Yeah.
Okay. Yeah, that's fair. Cost is always going to vary. And that depends on what kind of peptide. Is it the hair loss peptide probably costs different than the
Yeah. I in general, though, I would say peptides are certainly not cheap.
Okay.
Yeah.
So they're not cheap, but still, I mean, we're talking about life-saving, and even if just you got young kids, being around to take care of your kids in 2 weeks, or just being able to fight through, it's the cost kind of thing, kind of goes out the window. Talk a little bit about how you handled the quarantine. Did anybody else in your family get sick at all?
No, I was incredibly fortunate. I was around my wife throughout this time. I was around my 4-year-old and 6-year-old children, and they never developed any symptoms at all. My mother-in-law was with us quite a bit as well throughout this ordeal. And she's 70. Yeah, so I was particularly worried about her. But she never got sick either. I'm very fortunate that it didn't get worse than that. Yeah.
Yeah. Wow. Yeah. No kidding.
Yeah.
Okay, let's go back a little bit and talk about doctor care and what we individually can do. So I need a doctor, but how many doctors know to even prescribe this? I mean, we have to at some point own our own medical care, so we need to get smart. But what words do we say to our doctor to say, hey, I want to be armed in case something happens? Not that doctors need extra visits right now, but how do we educate our care provider to get access to something like this?
It comes down to finding a provider who is focused on preventive medicine and precision medicine and health optimization. And in this day and age, in our U.S. healthcare system currently, most medical doctors are focused on disease, and we're focused on stamping out your symptoms and treating disease. And that's just the way we were trained. When we go to medical school, I know how to take out your kidney. I know how to save your life if you're bleeding out. I know how to take out your kidney stone and do your vasectomy. All these different treatments that I can do. But there's really very little focus on health optimization. And so it comes down to finding doctors who have an emphasis and a priority on preventive medicine. And it's something that's unfortunately really lacking in our U.S. healthcare system. I have become incredibly passionate about it, however, over the last 5 to 10 years or so, though.
So part of what we're talking about here is overall preparedness. I mean, look, you live in Florida. I'm sure you've got ways to board up the house and survive if a hurricane comes, right? Because that's what Floridians have to do. But we also have to look at our health, it sounds like, as a thing to be prepared in case, like, here comes cold and flu season. Well, I'm already, zinced up and vitamin C and all those things, but also eating well and getting rest. I mean, all of these things help you to prepare for these kinds of things, whether you get it or not.
Yeah, absolutely. It's preventive medicine is focused on preparing yourself for times like these, and optimizing your body to be at its peak function. And it also promotes longevity. And we talk about all the science behind reversing, not just slowing, but actually reversing aging and expanding longevity. And a lot of this comes down to understanding the biochemistry behind cellular aging. And that means chronic inflammation and hormone optimization and autophagy and all these other cellular processes that we can impact directly through lifestyle and optimizing our hormones and optimizing our stress and our micronutrient levels. And so it's an exciting, incredible time right now in medicine in this area of focusing on health optimization.
Yeah, the day we had on Dr. Kabran Chopik, I don't think that episode is launched yet, but he focuses on the brain, and you're going to recognize some of the things I'm about to say. He said, 1, swelling is terrible for your body in all ways. 2, sugar, carbohydrates cause swelling everywhere, and so you have to avoid sugar. And he's like, if you think about the brain and how delicate it is, he said, if you remove a brain from a body, obviously this person is deceased, and if you leave it sitting on a table, he's like, it's just a pie, it's butter, it'll be a pile of goo in a short amount of time because it's just that delicate. And it's a great way to look at our systems in general. I mean, I imagine your liver doesn't fare well if you don't care for it, and your kidneys and your heart and your lungs and your skin. Oh my God. There's so many things to take care of.
Sure. Yeah. A great analogy is your house. Well, are you taking care of your house? Are you mowing the yard? Are you changing the air filters? Are you getting routine service done? And if you don't, what happens? And same thing goes for your car. Are you changing the oil? Are you getting a tune-up done routinely? Are you're rotating your tires? Are you doing all the things to keep it running? People think of doing those things, but yet when it comes to your body, to your health, somehow that's just kind of an autopilot thing, or I'll worry about it when I get sick. I'll treat the symptoms, treat the disease when things go wrong. And I think that's a big reason why America has fairly poor health, is because of that. And that puts us behind the 8 ball in situations like this pandemic.
Yeah, it's almost as if I like to think of it as a retirement account, and not that I'm a great investor. I'm trying to be better at it, but if you're constantly taking withdrawals and making bad investments for the future, you're starving all of your systems of the things they need to survive. And then here comes COVID.
Yeah. Yeah, there you go. I like that analogy. Yeah.
Yeah. Okay. So how the heck do you even know you had COVID? I thought it was impossible to get tests.
Well, you're right. It is impossible. Or at least it was then. It's getting a little easier now. But at that time, when I developed the symptoms, I initially had fear of what was going to come. And I kept myself calm and, used, some mindfulness techniques to get myself in a good place. I talked to the local epidemiologist. He's an infectious disease doctor and friend of mine. And made it clear that, look, as a physician, I'm on the front lines. I need to be available to take care of my patients, and I need to know if I have it or not. And given the symptoms I had, it did not warrant hospitalization. It did not warrant even an emergency room visit at that time. But I still had to know and get tested. At that time, there was no testing locally. There was no drive-through testing. There was no options here unless you were hospitalized with severe life-threatening symptoms. However, he was able to make an exception for me because I'm a physician, because I needed to get tested for those reasons. And so I went to the emergency room that Monday morning, and they were able to get me tested as an outpatient, which, again, I was very fortunate to be able to get tested, but it was not the standard of care yet. It was relatively impossible still to get a test unless you were on the verge of dying.
Yeah.
So I went home that day and expecting to get a result in a couple of days. And so I closed my medical practice that week. I had a full schedule that week. I actually had surgeries Monday morning that I canceled. And throughout the week, I closed my office and did some telemedicine remotely from home. But otherwise, I had to cancel or reschedule a lot of patients. The week went by. And I'm, pins and needles. I'm, fearful of the results and fearful that my wife and children are going to develop symptoms as well. And Wednesday comes, Thursday comes, Friday comes, still no results. And the infectious disease doctor is able to track down that my lab test was sent by Quest out to California, from Florida out to California for reasons that we don't even understand, but the lab was unable to handle the volume in Florida, so they sent it to California. That added about a week delay in my results. And so it was not until the following, when it was 10 days later when I finally got the results. So through that time, it was a stressful time, and the unknown is tough, but I had no other symptoms after those initial 24 hours beyond this intense fatigue, this dense mind fog and fatigue and vague dizziness that made me just want to sleep the day away. Go ahead.
Have you been that sick before?
Oh, never. Nothing like this ever in my life. Yeah, very different than anything I've experienced. I have slowly recovered from then. I'm still incredibly tired. I've been doing a lot of telemedicine. After my 2 weeks of quarantine, I was cleared by the infectious disease doc to go back to work. I continue to wear a mask, however, just for everyone's safety. And, there's a lot of fear and disinformation and lack of knowledge around when are you free of the disease? When are you clear? When do you have antibodies? And, when can you be around other people? And so there were certainly some challenges going back to work around that. And so I wore a mask for a while just to keep everyone happy and feel safe. And it's been a process. It's been a challenge with, the fear of my family developing any problems, the fear around when can I go back to work safely? Are my symptoms going to get worse? And it's been a humbling experience, to say the least. I am finally coming out of the fog, though, and kind of getting back to it. Yeah.
I have been really sick before. When I was in Afghanistan, my research partner, Rich, got just super, not deathly ill. You say that, but not deathly ill, but just like super sick. And I'm like, here it comes. There's nothing I can do, because we're in the field together and we're still working. We don't have a choice. And we ended up being laid up in our cots. We had to shut down because it was just horrible. And then we were in a tent that was 10 degrees. That was it. It was cold. Yeah. We were wearing all of our clothes in our sleeping bags, suffering through.
Damn.
Yeah. So there's been a couple of times when I've been super, super sick, but I've never felt like I had to go to the hospital. I always felt like it would pass. But now as I look at it, like some of these times I probably should have gone in instead of just toughing it out.
Sure.
It's crazy, So, okay, you get the test, you understand that you have COVID, but yeah, you're a doctor and you have patients, so they need to see you. But also, you've got to put yourself, even though I'm doing quoted fingers, cleared. No one necessarily is going to believe that, and it's such a terrifying thing because people are dying. Tens of thousands of people are dying from this around the world.
Yeah.
So, how do you deal with that perception? And then, do you? Like every time I took a urinalysis in the Army, I'm like, I know I haven't done anything, but weird things happen. I hope I don't, give it a positive test. I mean, can you have a false negative with this test?
Oh, absolutely. Yeah, I think it is possible to have a false negative. I've had so many people come in either virtually or through Facebook messaging, for example, friends, colleagues, clients who have had symptoms, and they went to the ER, got tested, they were negative, but they had significant symptoms that certainly suggested corona. And why those tests were negative, I can't tell you. I don't know. But I think, with social distancing, with quarantines, I think that's really, if nothing else, prevented it from spreading if they did have it. But after 14 days, you develop IgG antibodies, and so you are theoretically immune to it. So I believe at this point I am safe and clear. So the stories you hear of, can someone get reinfected with it? I don't know if that's really possible. I think that those people may have been, never fully cleared in the first place. I think there's still a lot of confusion and a lot to learn still about those details.
You can also catch the regular cold or flu or some other kind of thing as well. I mean, I've had times where I've caught a cold back to back before.
Yeah, sure. Yeah, you could have other respiratory illnesses as well that may mimic COVID, or it's not the only disease people are dealing with right now. So absolutely. Yeah.
How did your wife deal with all of this?
Stressed, worried. I sent them away initially, sent them to my mother-in-law's house when things first happened that Friday night, and they they were good sports about it. They were supportive, but she's worried about herself, but really more than anything, worried about her kids and worried about our kids, and worried about her mom, who's most vulnerable throughout all this. So she was strong, but certainly concerned. Yeah.
And then your house now has to be, I'll say the words, deloused, decontaminated. Is that something that you just spent time steadily wiping everything down? Do you hire someone? Do you expose someone else to the house? How do you handle that?
Yeah, we were obsessed with decontamination for quite a while there, for a couple of weeks there, where we've exhausted all of our sanitizing wipes and the Clorox and everything else, because it can stay on surfaces for a couple of days, as we know. It can be even airborne as well, from respiratory droplets. So you can only do the best you can. But the fact that I was around them so much in the beginning there, I think that it's likely that they are asymptomatic carriers. I can't know that without an antibody test for them. I'm hoping that someday in the near future we'll be able to test them. I've actually volunteered personally to be part of the clinical trial locally to do a convalescent donor for serum. So because I believe to have antibodies for it now, I'm going to be donating serum to potentially treat COVID patients who are struggling with life-threatening disease in the ICU and as a last resort treatment. As part of that, I have to be tested for antibodies. So I have been tested. I'm waiting for the results for that, but I'm hoping that very soon we'll have a test for the public in general.
So the timeline on a test for COVID, just the straight, do I have it? What is that timeline approximately?
It's supposed to be a couple days. For
Okay.
most people, 2 days. They talk about this rapid test, which can be 15 minutes. That's certainly not widely available at this time, as of today. But in general, it's supposed to be 2 days or so, 2 to 3 days. I've heard other people saying it takes 5 to 7 days. Again, mine was 10 days. I think it was probably from the lab issues they were having. This was back when things were first starting to become a big deal. Now I think they've improved their testing capacity. So I think 2 to 3 days is probably realistic.
And then what about the antibody test? How long do those things typically take?
Yeah, I'm not sure. I think that's a few days. Not sure. That's so new. That's we're such an early phase in the testing process. I can't even tell you. When I get mine back, I'll share with you how long that took. Yeah.
Yeah, because it's interesting. I mean, there's been times where I thought I probably had the flu, but by the time you go get tested and get your thing back, you're like, you've recovered. And all I've done is gone to the emergency room, exposed people to the flu, and spent money on a test to find out that that thing you just beat was the flu.
Yeah.
Okay. So testing aside, antibodies aside, is this going to change how we even see? I mean, look, 80,000 people died last year from the flu in the States, right? It was a bad flu season. Is this going to change how we handle these things, do you think?
I think this is definitely going to cause a rapid expansion in telemedicine and telehealth.
Mm-hmm.
Anything we can do to keep people out of the emergency room, out of an acute care situation where they're potentially going to spread it to other people who are there. I was had to go to the ER last year because I rolled my ankle and I couldn't walk and I needed an X-ray. And so imagine being in the ER because you rolled your ankle and need an ankle X-ray, and you're surrounded by a bunch of people who are COVID positive, and you've now acquired that disease simply because you're in the ER. So the point here is this is going to usher in a new age of medicine, in my opinion. I think this is going to rapidly expand the focus on telemedicine and telehealth, and keep people out of the ER. And beyond that, that enables us to improve the efficiency of our systems as well. I see tons of men now via telemedicine who never would have done it a month ago, but that has prompted us to make changes. And so that enables us to provide efficient healthcare while you're at home in your sweatshirt and no pants, I'm sure, Pete.
Pajama pants. It's cold. Yeah, it definitely is going to change things. I mean, you talked about rolling your ankle and getting an X-ray. I haven't done that since I was a kid. I rolled my ankle and I'm like, I've rolled my ankle. It's going to hurt like a son of a bitch. And as long as I walk in a straight line, it's going to get better. I don't want to go to the hospital for that. Telemedicine really is not the answer for a rolled ankle, but I think you're right. And then just in general, I think how we look at the flu and how we treat, our contagious status. I mean, how many people just go to work because they don't want to miss a day at work? And it's like, hey, do everyone a favor, stay home.
Right. And this lends itself well to the clients I work with. I work with a lot of executives, CEOs, entrepreneurs who have an incredibly busy life, and they're very deep into their work on a daily basis, and they don't have time to drive 30 minutes to my office, see me for 30 minutes in the office, drive back home again every time they need to see me. Now I'm getting on calls like this, whether it's Zoom or Blue Jeans or whatever source, to quickly and effectively communicate with them and help manage their situation. And most of the time, they don't need to be in the office, in the physical office. We can manage it like this. So it's really going to revolutionize how we look at healthcare.
How are you going to use this with your practice specifically? I mean, I know you have guys you talk to, but what's the limit for what you can do with this?
Yeah, great question. I have converted my practice just in the last 2 weeks to about, I'd say, 70% telemedicine. Some men still need to come in the office for certain reasons, whether it's for a medication, for a test, for whatever. They need physical interaction or they need a physical exam or something. But in general, most of the visits can be managed virtually like this. And that's really the impetus here, is to to recognize what can we do virtually and, make those changes.
Has this made you a better doctor in terms of your ability to care for patients more? I mean, it seems like every time I go to the doctor, especially at the VA, like there's just no time. They come in, everything's been done. They sort of look at everything and go, matter of fact, the last time I saw a VA doctor was post-op for a hernia. And the guy had not performed the surgery, had not read my chart, sat down and said to me, "First time at the VA?" And I was
Yeah, I think whenever a physician is suddenly on the other side and becomes a patient, it reminds us it's a humbling reminder of what it's like to be the patient. And when I sat in that emergency room that Monday morning to get my test, it wasn't just walk in and walk out. I was a regular ER patient, and it's it's not fun. It's humbling. It's you're full of fear. You're tired. You're stressed. And so I was already compassionate. I feel I'm a very compassionate person when it comes to my patients, my clients, in life in general. But when you go through that personal experience, it definitely reminds you what it's like, and it gives you a different perspective when you're facing a life-threatening disease.
So you've got 3 big takeaways in your article on LinkedIn. You talk about, and you've said it in this episode several times, you talked about positive mindset and how critical it is.
Yeah.
But there's so much fear. There's so much uncertainty. Look, most people don't deal with this much adversity in 5 years, let alone 5 weeks.
Yeah. Yeah, you're absolutely right. And a lot of it comes down to practicing mindful techniques, whether it's, meditation, whether it's breathing techniques, whether it's, talking to yourself with positivity, and focusing on a proper positive mindset. And fear is the reservoir for disease. Fear is reservoir for stress. Fear raises cortisol. Cortisol raises blood sugar. Cortisol causes you to gain weight. Cortisol crushes your testosterone. Cortisol crushes your sleep. You see where I'm going here.
I thought you were describing me.
But my point here is to simply show you the incredible negative impact that fear has at a physiologic level.
Yeah.
And so the first thing people need to focus on is getting rid of their fear. And, sure, it's a scary time right now and there's a lot of unknown, but we need to focus on what we do know, focus on staying positive and being proactive. And a lot of that goes back to, again, preventive medicine, and focus on optimizing your health so that you are prepared and that you're ready if something happens. So mindset for me, even before Corona came around, I talked about my Mel 2.0 approach. The M is mindset, and it all starts with mindset. And that's no more important than right now going through this. Yeah. The second point I believe I made was what we've talked about a lot here today, and that is, your baseline health is going to be your starting point when diseases like this set in, or when we're faced with a scary pandemic. And everything you can do to optimize yourself will only put you in a better position to handle it.
So everything you can do to optimize yourself, but this is day 1 of my optimization plan. Like, what are the first steps? Like, what can everybody absolutely do? And I'm going to take one from you, because I know you said this before, so you don't get this one, but you're going to recommend that you always get those full 8 hours of sleep. That's invaluable. So you've said that in the past. What else?
And I would take that actually a step further, Pete. I would say,
can I have an app?
Yes. You need to track your sleep. So, you say 8 hours of sleep. Some people can get away with 7 to 7.5 hours of sleep, and your genetics can definitely come into play there. But the key point there is, how do you know the quality of your sleep? And so unless you're tracking your sleep and working with someone, if you're not familiar with how to do that, to know the quality of your sleep, because there are different stages of your sleep. There's light sleep, there's deep sleep, there's REM. And unless you're getting good quality sleep, which means good deep sleep and REM sleep, then you're not really getting good restorative sleep. And so I've had guys who come in with their data that shows they're sleeping 8.5 hours a night, but you look at their deep sleep and they have 20 minutes of deep sleep all night. And so that's non-restorative sleep. So that point about sleep is critical, but you need to focus on not just the quantity, but also the quality. We can look at nutrition and focus on something you can do today, and that is to cut out the simple sugars, cut out the refined sugars, and that means the candies, the cakes, the jujubes, the chips, the cookies.
The chips. Yeah. Leave my chips alone.
That there are good carbs and bad carbs.
Yeah.
And when it comes to your blood sugar regulation, which is going to definitely affect your metabolism, your energy, your cognitive function, your ability to lose weight. One of the key things you need to do is cut out the sugars. I would also add in there intermittent fasting. So not necessarily what you eat, but when you eat. And one tool that's incredibly effective, I've seen so many men lose weight immediately, is intermittent fasting, where you eat within an 8-hour window of the day and you fast for a 16-hour window of the day. And just that one maneuver of giving your body a chance to practice autophagy, which I like to say is simply just taking out the trash, getting rid of the cellular debris, the waste product, is going to give you a world of benefit. So again, not just what you eat, but when you eat.
Not just what you eat, but when you eat. Yeah, no, that's great. I had a question about just thinking about the eating thing, but the sleep part, you said tracking your sleep. I don't understand what that means. How do you track your sleep?
Sure. So great question, Pete. There are devices that you can use. You have all the good questions. There are wearable devices that you can use, that you can wear, that will track your sleep for you. Okay. There are iPhone apps as well. I find them to be very unreliable. I have a Garmin Phoenix watch, which is incredibly effective for tracking your sleep, for tracking your activity, for tracking your heart rate variability, which is a biomarker directly related to your health. But with these devices, the Aura Ring is another great tool. It's a ring you wear throughout the day, but specifically at night is when it's most important. So these tools will track the quantity of sleep. How long have you slept? When did you wake up? You have micro awakenings throughout the night where you're awake but may not be aware of it. It tracks the quality of your sleep, including the light sleep stages as well as the deep sleep stages. And so these wearable devices, this incredible technology we have available now, I use with all the guys I work with, so that we're not guessing. We're not just relying on how well you think you slept, but we're actually using real data.
So data-driven sleep analysis used through the phone and the ring, that kind of thing, that'll give you an idea of how long you're down for. What is another baby step that someone can take? And again, I guess the point to say this here is, how do you prepare for the next COVID thing, the next whatever it's going to be? And which, by the way, simultaneously also hardens you against things like, kidney disease, liver disease, pre-diabetes. All of these things kind of go together.
Sure.
So, what's one other very simple thing besides sleep?
So we could look at mindful techniques. I love meditation. I find it incredibly valuable myself. So what I mean by this is there are many ways to meditate. For most men who I work with, they have no clue what it means. It sounds kind of woo-woo and they don't understand it. And it's very simple. There are apps that you can get on your phone. I use one called Headspace. There are several ones. Calm is another beginner one for guys as well. There are hundreds of apps you can use out there just to kind of get you started so you understand how to meditate. But I practice meditation in the morning when I wake up, and then sometime throughout the day. So I'll give you an example for me. I think I've shared this before, but when I leave work, when I leave my office to go home, I'm heading home to two little kids who are going to jump on me and want my full undivided attention, and they want to play and they want my, my energy. And when I'm at work, my mind is focused on business. It's focused on taking care of my clients and patients. And so meditation for me is incredibly effective to get me centered, focused, get my mind clear so that I can in some way compartmentalize the stresses of work so that I can come home and be present and be engaged and be focused and clear. And so I practice 10 minutes of meditation on my way home from work, and practice meditation in the morning to kind of get the day going as well. And so there are many ways of practicing meditation, and without being too woo-woo about it, I'll simply say that there's a lot of science behind it that shows that it helps with reducing cortisol, with minimizing your stress response, and that has a ton of physiologic benefits to it as well.
Your third point was we need a much better system of testing, access, the timeliness of it, all of these things. But give us the deep dive.
Yeah, it's time to get back. It's time to get back to society. The economy needs to get going again. We all need to get out there for so many reasons. But the question is, how do we do that safely? How do we know that when we go out to a restaurant to eat, for example, or when you go to the store, how do you know that the people around you are not going to infect you and kill you? I mean, it comes down to that. And the answer is antibody testing. We have to have antibody testing to know who's safe, to know who's clear. And I think that is really critical, and it's lacking right now. I hope that it's coming. I know they're working on it, but we need to know, we need to know who has the disease for sure. If you get sick and you develop symptoms, you need to know. But more important than that, we need to know all the people who are asymptomatic carriers, who are clear of the disease, so that we know that those people are safe. And that's going to help guide our decisions on how to reopen this country.
How do we know if we're asymptomatic carriers? And we always look at everybody else. Look at that person. Look at that. But it could be me,
Sure. Yeah, it could be. You have no way of knowing it. That's the problem. Yeah.
Yeah. And then a lot of my PhD friends, the kind of doctors that don't help anybody, they all want there to be like a randomized testing so we can learn more about how the disease impacts socially and how it moves around. And we don't have that capability either, so that we can more efficiently and appropriately respond to these things. Maybe we don't need to crash our entire economy. Maybe we do, but we don't really know because we haven't done the big kind of testing it would take to do that.
Yeah, you're exactly right. And this is why testing is so important, to know that, to understand that better than we do now, of how do we track the spread of the disease and how do we know who is safe and who's not. And that's a pretty formidable task for us right now, but we've got to figure that out quickly so we can get back to life.
Does this same thing apply to the flu? Because again, the flu happens every year and takes tens of thousands of Americans with it.
Yeah. Yeah, the flu is different. I know a lot of people like to compare this to the flu, and they look at the mortality of the flu. The mortality of the flu is much less than the mortality of COVID. To be clear, you quoted numbers on how many people die from flu. You're absolutely right. Those numbers are irrefutable. However, you look at the mortality of the flu, and it's actually much, much less than what corona, even though corona is only 1%, the mortality from flu is actually much, much less than that. And it tends to be spread out. The timing of the spread of the flu virus, influenza, is such that it does not overwhelm our healthcare system. And that's where COVID is so different. It's much more contagious. You could spread it from one person, can spread it to as many as 3 people, whereas the flu tends to be 1-to-1 in general. But the key with corona is that exponential spread of the disease is why New York is where it is now, is why they're looking at burying unclaimed bodies on an island right now, because they're running out of space for more dead bodies.
Yeah.
For that to happen here in the United States in this day and age is unheard of. And that's what they mean by overwhelming the healthcare system. And so that's why coronavirus is really just nothing like influenza.
Because these things happen, and I'm going to guess they happen more frequently than once every 100 years, but because they do happen, when COVID-25 comes down the pipe and is just as, if not more lethal and contagious, is the mindfulness, is the precision medicine approach, is that still going to be valid for the next thing, do you think?
Oh, I think this is the tipping point. I think this is what will hopefully and should really launch precision medicine and health optimization to a much bigger place in society. I think it's so critical that people focus on this. This should be a pivotal moment.
What question have I not asked you that you think we should cover? I mean, you're the one that went through this whole thing. So what are we missing?
You know, Pete, I think you've asked great questions. I think we've talked about, what I don't want to do is tell people go wash your hands, don't touch your face. People have heard all that already. At this point in the game, people are tired of hearing all that stuff, and it's important. We know that already. I think now it's time to kind of take it to the next level of what have we learned from this and how do we move forward? And I think the answer is preventive medicine, being proactive, focusing on cutting edge tools like peptides, for example, wearable technology to track and improve our health, and not waiting for disease. And I think all those aspects of precision medicine that I preach, I truly believe saved my life.
We had on Peter Justin the other day. He's a longevity body hacking guy, and he was talking that people like Peter Diamandis and others are saying that we're going to reach exit velocity on aging here in the next, let's say, 20 years, right? And they said less than that, where we'll be able to not only live longer, but reverse aging and get to like 300 years and that kind of thing. First off, I don't want to have to work for 275 years. I don't want to do that. But these guys are all talking about that. This is part of the precision medicine model, though, right? To like get ahead, invest in our wealth, and not only stop crushing our own longevity and mobility and quality of life, but also start reinvesting into it and getting some gains back.
Sure. Yeah, there are tools available today, right here and now, that have scientific studies and research behind them that show that they can actually reverse aging. And it sounds sci-fi, it sounds ridiculous and incredible, but the data is there. Now, a lot of it's in animal studies, so it needs to be recreated in human studies. And we're continuing to learn about this, but it's coming. And we're not going to live to be 300. I think that's fantasy. Yeah. But we can expand our longevity by a few years now. And then in 5 years from now, we'll learn how to expand another 5 years. And then in 10 years from now, we'll learn how to expand another 5 years. And gradually, as we put all the pieces together, we can do that because we now understand at a cellular level what causes aging, what causes cellular aging. And we know these fundamental hallmarks of aging, how to impact those. And so it's a fascinating time in medicine right now for that. Yeah.
Yeah, it sure is. And I appreciate you coming on and giving us your story. Everybody should go check out the article on LinkedIn. I'll post that in the show notes. Obviously, go to your website, drtracygapin.com. What else can we do to learn more about what you do and get a hold of you?
Yeah, you could check out my my website, as you mentioned. There are a couple downloads on there. You sign up for my newsletter where I share some cutting edge content on a regular basis as well. You're welcome to reach out to me through LinkedIn as well if you have any questions.
Hey, thanks a lot for coming on. I appreciate it.